Hi, my name is Daniela Montanero and I'm going to talk about heart and lung transplant from HCV-infected donors to uninfected recipients. Definition: people with hepatitis C may be organ donors as well as those who do not have this infection, according to a protocol being finalized by the National Transplant Organization. The main cause of this change is the success of the new direct-acting antivirals, the hepatitis C virus. This will allow the organs to be transplanted even though there is a risk that recipients will acquire the liver infection, because when it is considered appropriate, you can start treatment against virus C, which is simple, short, effective, and does not interfere with the immunosuppressant, then take the receptor of an organ.
Reporter Stephanie Stoltz here with details on this just-released study.
That's right. This embargo just lifted at 5 o'clock. You know, this is an issue that is a byproduct of the deadly opioid crisis. Doctors say more donated organs are infected with the hepatitis C virus, and many are declined as a result. Well, now doctors are finding a way to use those organs and prevent transmission of the disease. You'd never know that 3 years ago, Connor Sullivan was in organ failure. A virus attacked the Air Force veteran's heart, and he needed a transplant.
Being on the transplant list, it's a constant worry in your mind of when you're going to get the call, if you're going to get the call.
About 1,000 patients die every year waiting for heart or lung transplants because there aren't enough organs available. His doctors told Connor about research involving organs infected with the hepatitis C virus.
Decided that was a good idea. It would allow me to get a heart quicker.
The new study shows researchers have been able to prevent transmission of the virus by treating heart and lung transplant patients with antiviral medications.
We started treatment of these patients as soon as it was safe to do so, within few hours after transplant.
In the study of 35 patients, there was a 100% success rate.
They had cleared their virus, the majority of the patients, within a few days, all by around the 2-week mark. And we saw no difference in outcomes in our hepatitis C group compared to our non-hepatitis C group.
After 18 months of waiting, Connor finally got his new heart. The 25-year-old is now training to run the Boston Marathon.
It means a lot to me. I think I have a lot of people to thank, and this will kind of be for them.
Wow. Now, the University of Pennsylvania had similar research where they successfully transplanted hepatitis C infected hearts into 10 uninfected patients and then cured them of the virus. So this research is ongoing, but it's been successful so far.
That's great to hear.
Applications in medicine. A shortage of available donor hearts and lungs limited transplantation in the United States, where approximately 1,000 patients die each year while waiting for these organs. Although organ transplantation has increased by 20% during the past 5 years, largely because of an increase in the number of available donors who have died from a drug overdose. Many organs that are otherwise medically suitable for transplantation have not been used because of hepatitis C virus infections in the donors.
Right now, as many as 4,000 people in the United States are waiting for a heart or full heart and lung transplant, and more than 25% of them will die before they can get a donor organ. So some of the top transplantation programs in the country are now addressing the shortage by accepting hearts from donors who had active hepatitis C. Recipients know they'll get the disease, but so far, they've all been cured. Carrie Hayes has had a faulty aortic valve since he was born.
I wasn't getting the oxygen that I was supposed to get. It would blood would flow back and forth instead of all one direction.
He got an artificial heart a year and a half ago, which is almost as long as he was on the list for a donor heart. His doctor finally found Carrie a heart from a donor who had Hep C. It could be cured with antiretrovirals after surgery. Carrie got his heart and just found out his Hep C is gone.
I felt that I was probably going to be cured, but it feels good to have somebody tell you, yes, you're officially cured.
Transplant surgeon Jorge Reyes says 20 livers and hearts from donors with circulating hepatitis C have gone to patients so far.
They're Hep C negative. They have never been exposed to hepatitis C. But their risk of dying of their liver disease or their heart disease, etc., is very high.
12 patients have been cured of Hep C, 7 are still getting treatment, and 1 died of transplant complications. No potential recipient has said no.
If we have a donor who is hepatitis C positive and with healthy organs, all those organs should be used.
Kerry is still taking a lot of anti-rejection medication, but he's delighted to get back to his normal life with Rena and his family.
All signs are pointing to getting back to being like everybody else.
Pros and cons. In all studies reported to date, transplant recipients have been cured of HCV acquired from the donor organ and have had good outcomes overall. Adverse events from the HCV or treatment have been extremely rare. Benefits. The benefits of strategies such as the utilization of HCV-infected donors that increase donor pool availability is that the people will be transplanted early and presumably at a healthier stage. The risks include an increasing viral load leading to hepatitis, inability to oral take the medication, resistance of the virus to the drug, and minor risks including nausea, emesis, and drug interaction that need to be avoided.
Lung transplantation and combined heart and lung transplantation is an excellent modality for patients who have got ILD, COPD, patients with cystic fibrosis, and bronchiectasis. Lung transplantation, the process is fairly simple. So as soon as the patient presents to us, we get him registered with the Noto registry. It's a central organ transplant registry. Once the wait is over, the organ donation becomes available. Our team goes into the donor hospital, retrieves the organs from there, and then we do the transplantation. So we do single lung transplantation, double lung transplantation, and combined heart and lung transplantation, depending upon the etiology of the disease. Our patients generally stay in the ICU for a week to 10 days, and then we shift them to the ward. They stay there for at least 3 to 4 weeks, and once everything is teed up, we discharge the patient from the hospital, and then the patients are being followed up regularly and very intensively with us and with their referring physicians. So at Max Saket, we've got a highly specialized team that specializes in lung transplantation and combined heart and lung transplantations, because at Max, we are eager to get you home.
Issue apply in Ecuador. In Ecuador, they have not yet performed heart or lung transplant from donors infected with hepatitis C to healthy donors. However, Spain has already successfully performed the first 2 heart transplants from donors infected with the hepatitis C virus, with good results. In Ecuador, 797 people are waiting for an organ transplant. I think that this advance will help this number decrease and the probabilities of life increase.
Risk, but how does the risk weigh against an organ? And we have a lot of patients on the list who need an organ, and the idea of wasting an organ is a tragedy.
It's true for all organs that we have more recipients waiting than we have donors available. We need to be thinking outside the box about what's acceptable for organ transplantation.
For decades, We as a transplant community have always shuddered from accepting organs from hepatitis C donors.
The community did not want to expose our patients to the risks of those infections, in part because we didn't have treatments.
2015 was a very important year for hepatitis C because that's really when the treatment for hepatitis C was revolutionized. At the same time, what we were dealing with, unfortunately, was the increase in the IV drug use epidemic.
We've seen more and more hepatitis C positive donors during the current opioid crisis. There were many, many organs out there that we were declining, and putting that together with the fact that we now have highly effective therapy is what led to the light bulb going off.
Many centers began to adopt hepatitis C donors with the idea that if the disease developed, they would eliminate the disease. The problem is that the treatment is very, very expensive. The Brigham basically took this leap in developing an entirely new concept around it.
We've been working on this study for many years. We wanted to show that you could safely and effectively transplant hearts and lungs from donors who had active hepatitis C in a way that you could then block viral transmission in the recipient.
Do a short course of treatment of just a month. Treat them right then and there at the time the organ is placed, within hours, and block the virus from ever setting up shop.
The question was really, were these organs any different and would the outcomes be any different? We started to actually enroll the first patient at the end of March of 2017. Officially, it's almost 7 months since your transplant. And are you continuing to do as well as you've been doing throughout?
Better. We hiked up a mountain the other day.
Some hiking?
If my lungs didn't pop then, they never will.
That's excellent. And from the hepatitis C perspective, everything couldn't be better. The results of the study were exciting. We have now transplanted over 60 patients, to our knowledge, the largest prospective trial that has been done to date.
As the first few patients cleared the virus, and it stayed cleared. That was very powerful.
That virus essentially cleared within 2 weeks of initiating the therapy. In terms of their survival to 6 months, things look the same as our standard of care.
The use of this course of treatment is 100% effective. This is a game changer finding.
The impact of this study does more than just show, yes, this can be done. We were able to really design a trial that can be used at other centers to be able to impact more patients.
If even half the centers in the United States were to adopt the Brigham protocol.
Conclusion. In patients without HCV infection who receive a heart or lung transplant from donors with hepatitis C viremia, treatment with an antiviral regimen for 4 weeks initiated within a few hours after transplantation, preventing the establishment of HCV infection.
I'm very happy to say that we've been able to implement the program successfully, ensure that our patients have access to organs that they might not have otherwise had access to. In my experience, virtually all folks who I've talked with before transplant, after hearing the pros and cons, have decided that it made sense for them to consider using such donors. I think we're all saying it's awesome because we see patients who have received and are doing well after an organ transplant who might not have lived to organ transplant if for whatever reason we had not had this program in place. I think none of us would have even had this discussion 10 years ago, but it's been made possible by the fact that we have good drugs for hepatitis C, that there's a growing body of evidence from multiple centers suggesting it's safe and feasible, and that there has been this increase in the number of potential donors who have hepatitis C. So all those have come together to make this the right time to consider and implement such a program. We're looking forward to continuing the process, broadening potentially this program to other organ transplants, again, ultimately with the goal of improving access to a life-saving procedure that patients might not otherwise have the opportunity to have.
The treatment went fine. No problems with that, no side effects. And the Hep C responded well in 8 weeks, and I was done. It's totally worth it. Of course I thought about it, but after all I've been through with the total artificial heart and just missing some matches by one antibody, because my antibodies were really hard to match, and I would have been foolish to say no. That's why I signed up, because it was getting to the point where I had to do something, and 2 weeks later they found a match, and I've actually talked to her about it, and and other patients that are waiting for a transplant, and I told them, sign up, do it. It's not anything to be afraid of. It's totally curable, and it drastically increases your odds of finding a match. Feels good to walk around and without pushing something around with me and being tethered to a machine all the time. And yeah, it's great to be able to just walk outside and do what I want to do, and work on my truck and do projects outside that I haven't been able to do for so long. Yeah, feels good to get back to normal life.
Thank you very much to watch my video.